Hello, everyone. I hope everybody is doing awesome. Today, we are in the second day of the new week. Today is Tuesday. I hope everybody, all the mothers out there, the grandmoms, I hope you all had a wonderful Mother's Day weekend. I'm so excited that God blessed me to be a mother, and I have my mother, I have my grandparents. So we are all blessed. My video today is for all the grandmoms, the grandmothers, our moms, our sisters, our female friends. Because guess what this week is? This week is Women's Health Awareness Week. This week is dedicated to women. So y'all know how we always working, right? So it's the women that carry the home. You know, if we're not taking care of the kids, we're taking care of the home. We're juggling the kids' activity. We're doing their homework. We're making sure, you know, that the husbands are well taken care of. And then on top of that, we go through so much. We have to always multitask. So if you find, you will see most women are always busy. We multitasking. We are the ones that carry the pregnancy. We give birth. You know, we go through so many hormonal changes in our bodies. We have to deal with menopause. And most time we are so busy that we don't have time to put our own health, to pay attention to our own health. Okay, we prioritize everybody else in our lives, and we are often put behind. You know, we make sure the kids are on time with all their annual physical, their dental work, all their medical exam. We make sure the husbands are on track. But when it comes to us, we always put ourselves behind because we put the needs of others before. But this week, I'm here to encourage you. This week is National Women's Health Awareness Week. So we go through so many changes in our body. It's time that this week we want to focus on you making your health a priority. Okay, as women, we are at high risk because we have all those hormonal changes from dealing with menopause, dealing with pregnancy. So we are at high risk of developing breast cancer. We are high risk of developing cervical cancer. And guess what? Research also shows that cardiovascular disease or heart disease is the number one killer of women. It's the number one killer of women is cardiovascular disease, or is the common name is heart disease. And Black women or African American women more so than women of other race. So that's even more reason why we should pay more attention to our health. I know we spend so much time on everybody else, but just this week, let us pay attention to those key things. So I'm just here to encourage you. So if you have not yet set up your appointment to have your annual physical checkup with your primary doctor, please do so. Those are important appointments that's needed. Your doctor will do a thorough head-to-toe assessment for you, listen to your heart, listen to your lungs, check your ears, and then they will also send you for annual blood work where you'll get your blood drawn. They will check your blood count, your complete blood count. They will check your labs that affect your kidney and different things in the body. So it's important. If you have not yet scheduled your annual physical this year, and if you are due, even if you're not due yet, make sure call your doctor and get that appointment scheduled. Schedule your appointment for your annual with your doctor. Also schedule your annual GYN appointment, gynecological appointment, where your doctor will check all your female parts and make sure everything is functioning accordingly. And then most importantly, I want to encourage you because like I said earlier, heart disease or cardiovascular disease is the number one killer of women. So as you are making your appointment with your primary care doctor, there are 5 key personal health numbers that can help you determine if you are at risk for heart disease. Meaning if there's something that's going to put you at that higher mark for getting heart disease at some point in your life. It's important that we know what these numbers are and know what to ask the doctor for, because most times the doctors may not order all those necessary tests. So as I always preach, we have to be our own advocates. We have to speak up for ourselves because what? It is your body. You are the manager of your body and your health. So if you're scheduling your appointment for your primary care doctor and Make sure you ask your doctor if they are scheduling these tests, which are important for your cardiovascular health. So you want to know what your total cholesterol is, your HDL, which is your high density lipoprotein, and that's pretty much your good cholesterol. So your total cholesterol level, know what your HDL, which is your good cholesterol level is. Have the doctor check your blood pressure, so you know if you are at the baseline of getting high blood pressure, or to know where you are with your blood pressure. And then also have the doctor check your blood sugar level, and then also you want to know where your body mass index is. The body mass index will tell you if you are obese, meaning if you are overweight or not, because obesity is also a risk factor that can put you at higher risk for cardiovascular disease. So this video is very short. I'm just here to encourage all my beautiful grandmothers, my mothers, my sisters, my friends, all our female relatives out there. Please do share with all mothers or the female person that you know in your life. Let us make our health a priority this week. Let us focus on getting our necessary tests. If you go to your gynecological appointment, your GYN appointment, they're going to do a breast exam on you. And if you are 40 years and over, please schedule your annual mammogram. It's a simple, kind of like an x-ray of your breast to see if there's anything that's abnormal in your breast. With breast cancer, the earlier it is detected, the better it is for you. And by the time you start feeling pain in your breast, or you start having symptoms of breast cancer, whether it's discharge from your nipples, or you feel like a hard substance, something that feels like solid rock in your breast, or lumps or whatever, is already far gone. So please let us stay on top of our make sure you get your annual mammogram if you are over 40, or it's even younger if you have a family history. Let's say your mom or somebody close to you in your family has had breast cancer or passed away from breast cancer. You want to check, have an annual mammogram done sooner than 40 years old. But these are things that you need to bring up to your doctor, your primary care doctor, your healthcare provider. So get your annual mammogram, schedule your annual physical. Ask the doctor to check those important labs that will tell you if you are at risk for heart disease, which is your total cholesterol, your HDL, which is your good cholesterol. Make sure you let the doctor check your blood pressure, your blood sugar, and your body mass index. If some of these things can be prevented, we can take little steps on our own to help decrease our risk. Because if your body mass index is high and you're gaining a lot of weight, you can start by walking 15 or 30 minutes 3 days a week. Watching what you eat. Start to eating more healthy stuff, more vegetables, more fruits in your diet. If your blood pressure is high, or your blood pressure is high, if we're cooking too much salt, you can start by cutting back on some of the salty foods that you eat. And likewise, if your blood sugar comes out to be high, then we can kind of revisit our diet. Most of these things are triggered by our diet and by our lifestyle. So I just want to encourage all my mothers out there. These are things that are possible. Let us make our health a priority, because our family needs us around. Remember, we are the carrier of the household. We carry the kids, we carry our husbands, we carry the family. So let us take our health seriously and prioritize our own health. Thank you. You all have a blessed and wonderful day, and I will catch up with you again later. Thank you so much for watching my video. Thank you for all your support. Bye.